My name's Amanda Turner. We are from Dothan. My husband is James Turner. We have 6 children combined. 2 have been to Snyder therapy. I never had learning disabilities. My husband has. He has struggled for years, but of course, as many, they compensate. Dallas is 13 now. She was 12 when she began. Avery, who is 9 years old, was 8 last year when she first went to Snyder. I could have had Dallas labeled and drugged at 6 months old. Early on, I could have had her labeled with ADHD with a little extra of the H, Asperger's. But in my opinion, drugs and labels were not the answer. She's always been very sensitive, had high anxiety, frequent meltdowns, hypersensitive to clothing, and difficulty seeing anyone else's opinion. I have always said that God made her that way. She's energetic, high-strung, and finicky. Avery, on the other hand, is more laid back. There were no odd signs that anything was amiss, but I knew different in the back of my mind. She was very smart. At the age of 3, she could put a United States puzzle together. I did not believe it, so I'm like, do it again. She did it again while I was watching. I tried to get her to start reading when she was 4. She refused. There was no interest. And of course, everyone said she will do it when she's ready. After all, she is the baby. I said, okay. Avery started kindergarten. She did okay. Nothing what I expected or hoped for, but she did okay. First grade came around. She did not progress. I did not think at all. I begged the school system for help and answers. Got nothing from them. The last 4 weeks of her first grade year, I withdrew her and homeschooled her. And the first 9 weeks of her second grade year. That year, Dallas also homeschooled for the first 9 weeks, which was her 6th grade year. But during fall break, the girls were exiled from their friends. Their friends were awful to them, and they begged to go back to school. They were tested within the first 2 days back to school. Dallas was on level, Avery was not, which I knew. I was called in for a meeting. They wanted to put Avery back in first grade, but not with the same teacher. I knew she was not on grade level. I had begged for answers the entire year before. When I questioned other children remaining in the second grade, whom also were not on grade level, I was told that my child did not have any problems. I was furious. I knew there was a problem, but I had no idea what it was or how to handle it or where to begin. Avery went through first grade again. She did okay, but I still knew that something was not right. Everyone told me that she would catch up when she was ready or when she matured a little more. For the record, those statements do not make a mother feel any better, especially when she knows something is wrong but cannot pinpoint it. She started second grade, still not on grade level. We stumbled through the first 9 weeks or so. One Sunday afternoon, I sat down to check and delete my emails, which I still was getting homeschool emails. One email led me to a website about learning difficulties and vision. This led me to Snyder Therapy Centers. I called the following Tuesday. The first person I spoke to was Miss Susan. She was very patient and gave me lots of information. I called back with other questions and spoke to Jason, who was also patient and answered all of my questions and then some. As it turned out, they were having a seminar in Destin, Florida within a few weeks, which is amazing how things work like that. My husband and I signed up for it. It was wonderful to finally hear a possible explanation of what was going on with Avery. At this point, during the conference, it dawned on me that Dallas had lived with her symptoms for 12 years, and I had no idea that something could be done about it besides drugs. Also, Dallas had always had to work harder at school than her older sisters, but I just thought some kids had to work harder. We scheduled testing for both girls. I was ready for some honest answers besides That is just who she is, and she will catch on when she is ready. The results for both girls were focusing disorder, which was the inability of the eyes to maintain clear visual acuity while reading close up. Binocular vision disorder, which was a tendency of the eyes to misalign inwards when the eye muscles fatigued. Tracking disorders, which was the inability for their eyes to move from one side of the page to the other. Constricted functional visual fields, they were tunnel visioned. Their vision was, one was 5 degrees, one was 7 degrees. So they saw nothing outside of their tissue roll. Deficits in motor planning and sequencing, and hearing distortions. I think Dallas's hearing was very acute. Dallas also had sensory integration dysfunction, which was her problems processing all the stimuli around her. Sometimes doing one little thing outside of a regular routine would send her over the edge. And for about a year, she had told me several times that she was angry, but she had no idea why. There was no specific reason. We came home, we discussed it, but of course, we could not tell one daughter to sit in the corner and deal with it while we fixed another daughter. So we decided to go ahead and do the therapies for both. Every began ocular phototherapy. She brought a light box home with her, and she looked at her specific colors for 20 minutes each night. Now, by the time that was done, she was ready to fall out. She had never slept this good in her life. Dallas did go in for the sensory learning program. We went to Birmingham and stayed for 2 weeks. For 12 days, she went in a morning session and an afternoon session. And it does work. I have to admit, we had some good days, we had some bad days. But this was expected. We were told but we both were looking and keeping our eyes on the end goal. When we came home after the 12 days, Dallas brought home a light box also. But of course, she had it morning and night, and of course the colors were matched to her. So they were different from Every's. And before we came home, we put a plan in place for meltdowns and anger issues. If she got angry, she would go to her room by herself until she could calm down. Then the situation could be discussed. There were several times when I stopped siblings or friends from following her into her room. This helped to give her time to think about the situation that was taking place and to think before acting irrationally. And it did help. On December 19th, we had several checkups in the middle, but by December 19th, both girls' vision fields had opened to 38 degrees, which is in the normal range. They were actually able to test their blind spots. I was completely amazed. This was just from lights. They both were sleeping better by this time, which was amazing to me. And then we moved into phase 2. We began vision therapy. And yes, I said yes because it is a commitment on the part of the parents as well as the children. They began vision therapy in December of 2011. We drive to Birmingham every other week. They do a session in the morning, a session in the afternoon, and then we come home. They also continue to do exercises every day at home also. And they continued at each of their checks. They continue to improve. Every has only 8 more sessions in Birmingham. She continues to improve. She no longer skips words or complete lines when reading. She would skip complete lines and have no clue that she had done it. She still has problems with spelling, but it is improving. Dallas graduated from in-house therapy in Birmingham to home therapy September 18th, less than 2 weeks ago. earlier than predicted. We sat down that Tuesday afternoon to complete her paperwork. Dallas and I completed it together, one of which I'm going to show you. I'm not sure if you picked it up outside, which is a symptom sheet on Dallas that she and I completed last October 13th. Most of the symptoms were yes. There were more yeses than no's. I had filed this back in her file, had not looked at it since. After we completed all of our paperwork, Miss Josie, her therapist, had pulled out her sheet that okay, this was the one we had filled out, on Tuesday when we completed. She did most of it. It is all no's. Miss Josie then pulled out what we did last October. There were more yeses than no's. I said, Miss Josie, is there a candid camera in this room? I said, I can't believe that, but it is true. Dallas will continue her home therapy. She will have follow-ups in Birmingham to make sure she is continuing to improve. We're all so very proud of her. She started to wear blue jeans last winter, which in the past you could not get her to wear blue jeans because they did not feel right. Some of her shirts now still have tags in them. Meltdowns have drastically decreased in frequency and intensity. This says a lot, especially with all of this taking place. We're changing her brain while she is 12 and 13. Tough years. She does occasionally get upset, but all I have to say is 2 words: think and react. These are now her clues for her to stop and think before reacting to whatever has upset her, and it is working. Dallas and Every still have improvements to make, but we are a long way from where we were last year when we began, and I would not go back. And I'm going to say this, not to scare you, but to give you hope. There were only 2 or 3 times during this past year that I thought Dallas or I would not make it through this next year. Those times were early on when her brain was still changing the way it processed information. We're both in this room tonight to let you know that there is light at the end of the tunnel. We made it. The last year has been a whirlwind, but one day sticks in my mind. Dallas came home from school so excited. She tells me that everyone else had completed their test and had begun talking and carrying on, but she was able to concentrate and finish her test. This is why we do what we do for our kids. That day is what makes it all worth it. So if you ever question, it is all worth it, and it does tell its story. It works.